It's almost there. It's launching. All right, resuming. We're back on the air. And continuing from where we stopped. Viewers, we're back. Welcome back, my panel. Welcome back, everyone. We have started the discussion on diabetes, and we've done the groundwork from onset. Right now, we're going a little deeper into it. One of the things that I don't know why, whether it's by coincidence or just the way it is, diabetes is one of the sicknesses that has S on it, which means it comes with a lot of stuff. And funny enough, it starts with di, which is single. Di is single, but then end with many. so that means it's something that viewers, everyone need to pay serious attention to it. Because if it was a company, this is the kind of thing we call group of companies. You know, diabetes is group of illness, you know. So Dr. Cates, I want you to take the first row. What can we do? Permit me to ask, you might tell me you're not a dietitian expert, but again, nothing we're giving here is a prescription, it's just an information. Continuing the segment on diabetes, what can anyone do to help in diet, the reproduction of insulin from what we eat day by day?
Okay, let's double back to pre-diabetic that Dr. Judy was trying to say.
Okay.
Because that will be able to lead us into the next step of what can we do. Because pre-diabetic now, if it wasn't controlled, then it progresses to full diabetes.
Go for it.
So let's see what Dr. Judy have to say about pre-diabetic. Then we'll be able to talk about the risk factors is going to be able to lead you into what you have and what you can do to stop you from getting to being a diabetic. They will, if it's HIV, they tell you full-blown AIDS. So diabetes is what you can do to stop you from getting to full-blown being diabetic, you know. So
Dr. Judith, over to you.
Okay, when we talk about excuse me, pre-diabetes, because some people they have had pre-diabetes, but they don't really know what it is. Pre-diabetes, you know, which can lead to type 2 diabetes. And then, you know, just like Dr. Kate and Dr. Flores said earlier, that is when your cells become resistant to the action of insulin, which we all know. And instead of moving into your cells where it's needed for energy, then sugar now builds up in your bloodstream.
Go ahead.
Sorry, that's my home phone. I'm gonna ask my children to catch that.
Okay.
Go ahead, she'll take care of that. Go ahead.
Take care of it.
All these, although it is believed that, you know, genetics and environmental factors, they play a very big role in the development of type 2 diabetes. But overweight is highly linked to the development of type 2 diabetes. Though not everyone that has type 2 diabetes is overweight, but it is believed is strongly linked to it.
Yes, like what he said, just to support what Dr. Judy is talking about, overweight is the single most important risk factor in the development of type 2 diabetes. Single most important risk factor, because the more overweight you are, the more likely that your body is resistant to insulin. So that predisposes you to developing type 2 diabetes. But if you decrease the if you decrease your fat diet, reduce weight, and then exercise, this will be able to eliminate this risk factor that is overweight that Dr. Judy just talked about. So overweight is the single most important factor in developing type 2 diabetes because it builds up into your body being resistant to insulin and then the presentation of diabetes. And Dr. Judy, keep going. I don't need to. I'm just supporting what you're saying. And we can talk about every one of us for type 2 diabetes. We talk about age. You know, increasing age predisposes is another risk factor for developing type 2 diabetes. So, especially if you have a family history of your mother, father, aunt has diabetes, if you're over age 45, then you run the risk of developing type 2 diabetes. That's why American Academy of Family Practice encourages the screening of type 2 diabetes in any patient that is between 40 to 70 years at a screening. They included it in a heart screen for diabetes so that you'll be able to, because diabetes causes a lot of complications. So with you developing a heart disease, then a lot of things come in with it. But if it's included in this program so that you'll be able to diagnose between the age of 40, remember 45 are highest risk. So between the 40 and 70, if you go for a checkup, for the heart the disease checkup, they will be able to screen you for type 2 diabetes for you to be able to know, are you at risk? Are you heading towards that direction of having diabetes, or are you not? So with the screening process, you'll be able to know what are you at risk and then take a step. If you're overweight, then you change your lifestyle, healthy living, and then try to exercise, because statistically it has been proven that if you include you exercising like 150 minutes, which is 30 minutes every day, in your daily activities, that is like the likelihood of reducing your risk of developing type 2 diabetes is up to 5%, which of 5%, which is 5%, which is almost like it's gonna 5 times lower. So it's gonna reduce your risk of developing diabetes into 20 to 30%, as opposed to when you don't do anything. So all of them double back into the obesity and overweight that we're talking about. And then the age factor that comes into it. If you're obese, then that's another factor of you developing type 2 diabetes. Family history, you can't change your family. I mean, it is what it is. I can't say, no, what, my mother has diabetes, I'm going to switch over. Somebody else take over. It's not going to work like that. But the thing is, you know what to do. If you have a family history of diabetes in your family, then take a step forward. Watch your diet. We go back to again diet. Exercise, which is kind of like a little bit difficult for people that are living over here in America because it's a conscious effort. Because we go from our car to the office and then to work and then come back home. So it's not just like people in Nigeria that have to navigate around, walk around. Some of them walk to the bus stop to catch a bus and then go to offices and then walk to get to bus stop again. And then you have to trek from your house to the bus stop. So that's a form of exercise which they don't know. But then people over here are kind of like disadvantaged in the sense that you have your car, you get in a car, go to the office. So exercising here is a conscious effort for us to do, to lose weight and stay healthy, because you have to create that time, which most of us don't have. But then if you look at what the complications of diabetes and what other disease condition that it attracts to itself, then you will know that, I mean, it is a time well spent if you exercise at least 30 minutes a day for 5 days. But then they said if you can't, 3 days is still okay, but we are encouraged 30 minutes a day for 5 days. That will help to reduce this risk factor being obesity for causing type 2 diabetes. And
to add to that, actually, I was going to mention race. You know, according to research, you know, Blacks, Hispanics, American Indians, Asian Americans, these are people that have the higher risk. They have the higher risk, of developing diabetes. Again, if you're a woman, having a condition that is called polycystic ovary syndrome, yes, which is a condition characterized by irregular menstrual periods and excess hair growth and obesity. All of these they all increase your chances of diabetes. These are all risk factors.
Just to talk more about PCOS that Dr. G said, this condition is an imbalance in hormone within the system. So we all know the women, they have ovary. When there is like overturn of your ovary developing cyst, within abnormally developing cyst, that is a predisposing factor for developing type 2 diabetes. And then, like she said, again, or just in addition, pregnancy also is a factor, because half of the women that has gestational diabetes will go on ahead to develop type 2 diabetes within 15 years of their life. Half of them, 50. And then women that that have infants, children that are 9 pounds and over, which I have one too myself. My children are 9 pounds baby. Then you have to watch it, because it's not easy for you to, because you said, okay, I have big babies. Then you have big babies, it comes with its own complications. That will tell you to, you have big babies, you are at risk. Watch what you're doing, watch what's going on. My mother is diabetic too. Then that's 2 strikes against me. So I have to be able to see, okay, this is the factors, this is the risks I'm facing. What am I going to do? Again, what am I going to do to be able to prevent myself from progressing into getting a type 2 diabetes? That's why we keep hammering on change your diet, which I'm trying. It's not easy. Diabetic diet, if you have tried, because you say, before you give me something to eat, try it yourself and try and see. Because that's what we see. But before you encourage your patient on what they're going to do, try that food yourself and see how it's going to be. Oh, eat low sodium diet. Who wants a tasteless food? Nobody. but you know what? It's a conscious effort, okay? Then it's not like devoid of sodium. No. Table addition of sodium into, okay, mommy did not make this good, I'm going to add more sodium to that, Table addition of sodium into what already cooked. That's a major issue. And then your spices that you use, how much of sodium does it contain? So that's the thing. It's just like not devoid, because every electrolyte you have in the body has their own function, So you can't just say, I'm not going to eat sodium, then you develop another problem. What the thing is, what we're talking about is addition of more salt to what you already have on the table. That's a bigger issue. And using of spices, you have to coordinate which spices is more high in sodium and which one is low in sodium. That's an addition of how you're going to be able to eliminate eating high sodium diet. And then being diabetic, like we said, healthy diet. It's not easy. Like I said in other segment about cancer and all that, you need to be educated on that. That's why we have a nutritionist. And then that's why we have to even try to educate our doctor, our patient, and then refer them to the people that will help guide them. Because when you say, oh, you know what, I don't eat sugar, there is good sugar and there's bad one. It's not everything that you just like Dr. Flo was talking about orange juice. I'm going to talk about orange juice in conjunction of you already have diabetes. Orange juice can help save your life at times, depending on that. But I'm not saying that that because she's talking about prevention, okay? Prevention before you care. That's where her explanation was. In case somebody was listening to her and talking about, okay, get rid of orange juice. Yes, before you graduate, I usually use that word. Before you graduate to being called a diabetic, don't get there by excluding orange juice. That's what I mean, all the sugars that she was talking about. But then if you already got there, how do you help yourself not to die? from what is going to cause, from the complications that is going to present to you. Because that's where we get some of our type 1 diabetics, because they don't know. And by the time they present to you, they're almost dead, which is the children. It's usually some, oh, I don't know, I found my child, she didn't wake up, and then look at what it is. She got over 600, you know? So that's a bigger issue to that. So with all this put together, if you're obese, overweight, try to lose weight. Remember, it's being calculated by BMI. And then your age, if you're getting older, let's say younger, getting older, over 45, then try to screen yourself. Encourage your doctor. That's the way we're gonna talk about that too. How do you screen? So that you'll be able to know, what are you? Are you a risk factor? What you need to do? If your family history, take a step to help yourself not to get the diabetic. We're talking about pregnancy, a predisposing factor. If you're pregnant and have a baby over 9 pounds, and then your doctor need to follow you up after that to check and make sure that you're back, that you're not progressing into it, because they said half of women are at risk of developing diabetes after 15 years of having a big baby or having a gestational diabetes. Then PCOS, you can change it, is a disease condition which you have, but you know what? It comes with being overweight and all that, which you have to be able to cut back on. And sometimes we do put our patient in medication to help them lose that weight, and then so that they'll be able to not to develop the complications of this other disease that is like at least embedded in these diabetics.
And then we have the high blood pressure and the abnormal cholesterol are some of the risk factors as well.
Yeah, those things goes hand in hand, because whenever you get to like African Americans, that we talk about the blacks, it's not just like when you say African Americans, it's all of us. Okay, when you get to certain age, and we're gonna see your risk factor of developing a heart disease, which is another complication of diabetics. Because when you have a diabetic one, then you have high blood pressure, cholesterol follows it too, because they all have damages to the nerves and blood vessels and all that. When all these things, the buildup of sugar in the bloodstream, they're going to predispose you for all this disease to come into play. Okay, so you control one, you're going to be looking at to controlling the other ones, and then it's going to help you to put other ones at bay, or be delayed before they even manifest. But you can change your lifestyle. At least lifestyle changes is a big factor for you to be able to not develop diabetes.
Right.
Excellent. Now let's get to Dr. Flo. Dr. Flo, talk to us about diabetes management. How do we manage living with diabetes?
Okay. Yeah.
You're on mute. Unmute yourself. Unmute.
Okay.
Yeah.
Can you hear me now?
Yes.
So number one thing that can help us with any type of diseases is our immune system. Our immunity has to be very, very strong. But as we grow older, our immunity declines. So that's why you have to look for supplements that is good for immune system. If our immune system is very strong, all this problem of diabetes or viruses or high blood pressure will be something that will not even, get to you at all. Because all these viruses that is going on, pandemic and coronavirus, blah, blah, blah. If your immune system is very strong, just be hearing them, it will not come near you. So like the oranges that I talked before, if you have diabetes, the high one, and you are still drinking oranges because of all this sugar, you are kidding yourself. But those who have low blood sugar, when their blood sugar is low, for them to revive them is to give them orange juice because of the sugar. So give them the orange juice, because when I was working as a charge nurse, Now, some of the patients that have low blood sugar, they started sweating seriously and be dizzy. I have to be telling them, I have to be praying for them. Please don't die. Drink orange juice. Drink orange juice. Don't die on me. And then within the orange juice, then they'll be okay. Because the low, that's why I say that low of everything is bad. Low high blood pressure, low blood sugar, they are worse. So, but if it is high, it's manageable. You change your diet, you drink water and eat food, and then you have to, our immunity is very, very necessary, our immunity. Because if you have a very strong immunity, because all this in there in the cells, and all this, I have trillions of cells in our body. Any of the cells can be, damaged, and also all this side effect of medication is killing a lot of people, So the damage, the kidney, the liver, the pancreas, the gallbladder. So some people, they take their gallbladder out, but your gallbladder is not taken out. And for some reason, I normally tell my patients, why do they take your gallbladder out? They don't have to do it. You just take care of yourself. All this surgery is killing a lot of people. Because in this world, like I normally tell my patients, nobody in this world that have health challenges. Even a newborn baby that was just born today, they will see something on the baby. Everybody have, but the way we take care of it. And then people, they are so in a hurry. So that's why I say that natural health is not a quick fix. It takes time, but it's go to the root cause of the problem, and then you'll be free. For me, I used to have high blood pressure, serious one. To have fluid all over my body. My tummy was like everything big, because I was taking medication. Before I know about natural health, but I went back to college for 4 years to be a doctor of natural health. And then no more fluid, everything went down. And I thank God today for 18 years, no medication at all. Supplements, something for immunity. If your immunity is very strong, then you'll be okay. You'll be able to eat well. I know people like my age, they have serious of, I'm over 60. Some people, they have problem with their hand, they cannot do this, they cannot. But I thank God, I don't have any health issues because I do what I'm supposed to do. I don't eat meat, I don't eat chicken, no turkey. I eat seafood occasionally, a lot of mushroom, vegetables, you drink water, and then you'll be fine. So that's my advice to a lot of people. That's my advice. If you want to be healthy and live long, then take care of yourself. Don't eat. Not even sugar. Some people, if you want to eat rice, they can have a big bowl of rice and then finish it. It turns to carbohydrate. That's carbohydrates, it turns to sugar. Everything big. We cannot eat portion, just a little bit.
Portion plate, huh?
Exactly.
You have
a
a
little
portion
bit
plate?
and drink water. Because just say that, okay, I'm eating so that I cannot die. I'm not living in this world so that I can eat. See, some people will see their tummy. Oh, Jesus. We are killing ourselves. But if you have to eat right, eat.
Yeah, let me see the portion plate.
Portion control plate.
Yeah, portion.
Portion control plate.
Exactly. Mm-hmm. Just a little bit of this, plant-based. And then plant-based, a lot of different kind of, you cook it, you steam it, you eat it, So I just thank God that lots of my patients that are listening to me, they are so happy. There is one woman, 72 years old. She said, Dr. Akin, I pray for you every day. If not because of you, maybe I'll not be alive now. that when he was on medication, he had stroke twice. But now it's okay. He's taking all these natural supplements. He's coming to the clinic to do the services, and he's drinking water, alkaline water. He's eating vegetable, and he said that he's feeling strong all the time. Another one, 84-year-old man, still working in food depot, said that since I changed my diet, I am very strong. Because what is in this life? Nobody will live forever. As people, as they are burning people in this, people are coming to the world and people are going out. Our prayer.
Let me come in there and ask Dr. Judith, diet. Why is it so difficult for people to change diet?
Exactly. It's not difficult at all.
It is, I mean, some people find it very difficult to change diet because of what they started with, and initially.
Do you know why I asked that? And like Dr. Flo says, it's not difficult. If you go to a restaurant back in the days, before pandemic, sometimes I go, we stop by restaurants. I always look at people, okay, they take this, they're avoiding cholesterol, they're avoiding carbohydrates. But at the end of the day, sweet tea, give it to me, sweet tea. They take 1 cup, 2 glasses, 3 glasses, 4 glasses, sweet tea. It may not be difficult, but it's
killing themselves.
It's not actually, you see, the problem people have, let me say it, everybody has
not discipline.
As a human being, they want something tasty. It has to have some kind of taste to it.
Okay.
And if they don't get that taste, it's like, man, this doesn't taste good. This is sour. I can't take this. I can't eat this. And like Dr. Flores and Dr. Kate said, spices, salt, all those. I mean, I have seen people. Oh my goodness, many that when they cook, oh my goodness, this doesn't taste good. And especially if when you go to the restaurant and you see them, they'll be pouring table salt, table pepper, table everything.
Yeah.
It has already been cooked. So
it's
when
a
you
habit.
cook it, it's a habit, exactly. When you cook it, is better than adding those extra. I tell people that a pinch of salt, in your food is better for you to get the iodine in it than when you put a whole lot of salt in it to make it tasty. Just like Dr. Kate said about the spices. If you go through the list of the nutritional, quote unquote, nutritional, column of all the spices that you use, you will see that there's already salt in there. There's sodium. Why add more? I use a pinch of the iodized salt, just a pinch, to put in any food that I'm cooking. Whether it has taste or not, that's none of my business. I really don't care. All I want is for us to be healthy.
Exactly.
And your taste bud changes as the time goes on. So changing your diet initially it's not gonna be palatable. It's not gonna be delicious. You're not gonna eat. You won't wanna eat that. But as the time goes on, you will find out that you have got accustomed to the taste of that food without that much salt in it. And if check yourself, if you have ever been, let me say, fasted, or if you have ever been through cleansing and then change. Let me give you like example, my patient that have lost some weight, lose weight, and then they come. They've changed their diet, like you remember the TV show Heavy Losers? They have gone through dieting and they've gone through exercising. Yeah. Then some of them come back to tell you, even some of the patients come back to tell me that, look, man, I saw pizza and I ate that, and boy, I felt so bad because your body has gotten used to not eating the wrong food. And whenever you go back to giving it that wrong food, it will tell you that what you just did was wrong.
Yeah.
It usually reacts immediately to you giving it that wrong food.
Yeah.
You
Yeah.
know? But the thing is, for us to go into that, I encourage everybody, my patients, look, it's not like a quick fix that Dr. Florence was talking about. Nothing is a quick fix. Holistic health and every other thing in life, if you do it quick, it's gonna come back quick. But if you gradually change your lifestyle, what you're gonna be able to, because I can't say you eliminate everything that is sugar in life, then it's not gonna work. But if you gradually cut down on what you eat that is unhealthy, then your body will gradually get accustomed to that. And then you lose weight gradually, and then you'll be able to maintain the weight you have lost.
Yeah.
But if, okay, I have a wedding in 3 months' time, you know what, this weight gotta go. Then I lose it. That's just like every patient, oh God, you gotta have to write me something. This weight gotta go. I'm the chief bridesmaid. I can't be looking this way. So
Yeah.
you give them something and the weight goes away. But you gotta have to tell them it's not the best way to do it. It's not the best practice. Because if you slim down fast, then you're gonna go back. I have a patient that come, gastric sleeve. Their chop is stomach small, and then still they lose that weight, and then you know what? Cell expand when you give them more carbohydrate, they will still expand, and then the weight they lost during all the surgeries, they will still come back. So it's a gradual weight loss and a gradual change in lifestyle that will be able to get people will be able to benefit from, instead of going cold turkey and then coming back to whatever they did, they took away, they will still go back to it. Like one of my patients asked me, I mean, life is good. You're telling me eliminate everything that is good. When am I gonna eat that thing that is good? Is it when I die? So yeah, don't eat pizza, and then because you were encouraged not to go to a restaurant with buffet. Because you're just gonna, oh, I pay this amount of money. You know what? I gotta have to eat my money worth of food.
Stock up.
You know, you are encourage your patient not to, but you know what? Life is good. If I eliminate all this good stuff, is it when I die 6 feet that I'm going to be able to eat that which is good? No, you have to cut down little by little, step at a time for you to be able to maintain it. Otherwise, you lose it and you gain it back. Okay. Then we're gonna have to ask ourselves, what are the signs and symptoms? Because we are talking about, I don't want to let our viewers don't know really.
Yes, signs. Okay. Yes, signs and symptoms.
That's the first thing I said before.
Viewers, don't go nowhere. We will be right back on signs and symptoms. As soon as we make it back, Dr. Kate is going to jump right on it, signs and symptoms. If you're to the sound of our voice, we're discussing diabetes, types, causes, treatment, living with it, managing your life if you're diabetic. But when we come back, we're going to go into signs and symptoms. So don't go nowhere. We will be right back.